Morning. So glad everybody's here.
Hello, hello. Good morning. Good morning. Good morning. Hello and welcome. I'm glad that you're able to join us today on this wonderful Friday. It's a nice day out there in Arizona. And it's about time we got some cooler days. So I'm really delighted that we're there. So I wanted to just take a moment and welcome you. Those of you who haven't joined us before, my name is Jenny Beaver, and I'm the CEO of Fourth Trimester Arizona, a grassroots 501c3 collaborative of parents, families, health professionals, educators, and local organizations. We're on a mission to change the culture of parenting so no one has to do it alone. Thank you for joining us today for our fifth Fourth Trimester Ecosystem Lunchtime Conversation. As supporters of expectant and new parents, today we invite you to collectively explore maternal mental health policy and legislation at the state and federal level. For those of you who may be less familiar with Fourth Trimester Arizona, I'm going to switch the slide for me, Elizabeth. I'll begin with a brief introduction of our organization. We connect maternal and child healthcare providers, social support systems, and parent support groups to foster collaboration, education, and to increase access to local resources. Our programming includes three main focus areas. Our monthly village meetups for new parents that happen in 4 different places in Arizona, and right now they're all online. Our annual Fourth Trimester Conference for both parents and professionals. And lastly, today's focus area, our newly developing Fourth Trimester Ecosystem Initiative for all who care for pregnant people, new mothers, and their babies. The goal of the Fourth Trimester Ecosystem is to facilitate inclusive conversations about what is working and what needs to change to better support new families in Arizona. Thanks, Elizabeth. If you can forward the slide. So I just want to take a minute to express our deep gratitude to all those who were able to attend our inaugural Fourth Trimester Ecosystem Summit just 1 week ago today. We were absolutely thrilled with the turnout from our community who are committed to creating a new future for Arizona's new families where all are supported. This slide shows the results of a poll of those in attendance about what they want to envision as the future for new families in Arizona. And I love this one. I love word clouds in general, but this one in particular was really awesome for me. Those who are unable to attend all or some of the summit, the recorded sessions will be up in the conference platform this weekend. So if you want to get in there and check some of them out, they should be up this weekend. I'm going to forward the slide for me, Elizabeth. Today's topic is of particular relevance to the work we do at Fourth Trimester Arizona, not only because our mission is to change the culture of parenting so no one has to do it alone, but also because Fourth Trimester Arizona has been selected as the backbone organization for Arizona, the 2020 Mom Nonprofit Policy Fellows. The goal of the Fellows Program is to cultivate change at the state level to improve maternal mental health. This work is being spearheaded at the national level by Joy Burkhard, Crystal McCauley, and Cindy Lee Herrick of 2020 Mom. Go ahead and forward the slide for me. For today, we'll be hearing from our speakers about policy and legislative issues that impact maternal mental health at the national and state levels. Our time together will go something like this, with 20 minutes for each speaker to talk and about 10 minutes to ask additional questions. Next slide. Before we get started, let's review a few key items to ensure everyone is able to fully participate. During the presentations, please post all comments and questions in the chat box. We'll be monitoring the chat and responding to your comments and questions. We also ask that you please remain muted except for when you're in the breakout, except for when you're asking a question. Of course, then please unmute and join the discussion. And next, we request that you please enable your video if you're able, especially during the question and answer session. If you run into bandwidth issues, no worries, please turn off your camera. And lastly, we're recording this session so we can send it to you and anyone else who registered at a later date. All right. Our first speaker, Jamie Zalway Belsito, is the Maternal Mental Health Leadership Alliance's first full-time policy director. Jamie is a subject matter expert in maternal mental health policies at the state and federal level. A Boston native, Jamie is a commissioner on the Massachusetts Ellen Story Special Commission on Postpartum Depression and the former advocacy chair for the National Coalition for Maternal Mental Health. Jamie led a grassroots movement engaging mothers and families across the United States to help pass the Bringing Postpartum Depression Out of the Shadows Act in 2016, the first ever federal legislation addressing maternal mental health. Thanks so much, Jamie, for being here today. I'm going to go ahead and unmute yourself and share. We would love to hear from you.
I am so excited to be here. Jenny, thank you very much. Elizabeth and Breann, I really got a huge smile on my face when I heard you talk about the legislation that we as moms and families and every single person, almost every 50 states across the United States that was facing maternal mental health issues or had been affected by them and was on Facebook that I could find, we together changed national policy. And I'll come back by saying that's macro to micro. One voice can make a difference. And I'm fully committed to every single one of you here today to realize that that power within you, whatever that is, whatever is your passion, can make a difference in our day-to-day. And I think we're seeing that with fourth trimester work and with matrescence and the work that's being done in Arizona. So again, thank you, Jamie Zalloway Belsito. I'm the founder and of the Maternal Mental Health Leadership Alliance, which focuses solely on positive policy outcomes at the federal level. And I'm the current policy director, but I am a mom who also was affected by perinatal mental health disorders, not once, drum roll please, but twice, in completely two different manifestations. And as Jenny stated, I do live in the Boston area, just north of Boston. We pride ourselves on having excellent healthcare, and I couldn't find services if you paid me money. I felt like I was playing some odd Dungeons and Dragons game where I had to find a special wizard to help me. And my children are 11 and 8, so it isn't that long ago. And I continue to be very involved in what's happening here in the state, and women and families and birthing people are still having the same issues. So I'm planning on bringing up, oh, it says share screen. I got to press the share screen. Hold on. I'm going to bring up my presentation here. Okay. I'm also going to pop into the chat. Oh my gosh. Yeah, I apologize. I'm not too adept with being the one in control of these. So I'm going to pop into the chat an advocacy toolkit, because I want people to keep that in the forefront and the back of their minds, something to look at. They'll pull it up, bookmark it, keep it for later, but it goes into the advocacy piece. So look, I'm already at questions and answers and I haven't even started. Okay, so what are maternal mental health issues? We all know what these are. They affect 1 in 5 women that we are aware of, although it's probably 1 to 3 in the actual, if folks actually were screened appropriately and properly. So that is a large percentage of the population here. These illnesses are the #1 complication of pregnancy, and we're seeing that more and more in the maternal mortality review committees that are coming out, identifying what the maternal mortality challenges are. It's suicide, and I apologize for that triggering language and substance use comorbidities. But just even things like, hey, I don't feel like myself. I can't sleep because I can't go to sleep, or I'm having intrusive thoughts. All of these things, these are very, very normal. And there are extreme racial inequities that we're also uncovering. COVID took the lid off of everything that was broken to begin with. And here we are in conjunction with the Maternal Mortality Review Committee, seeing that there's a significant drop off in the postpartum period for people of color, and in our Indigenous population. I'll also take a moment to say I am broadcasting live from the Commonwealth of Massachusetts, which was the indigenous land of the Massachusetts people, and I sit in a small community called Topsfield, which was the Shenandoah tribe here, and so I would like to acknowledge that. Approximately 700 and it's more like 800 women, 8 to 850 women die from pregnancy-related issues in the United States annually. This has driven the CDC Hear Her campaign, and this is why we're seeing states like Arizona participate in trying to dig into why these issues are even going on. We spend the most money per capita, per person in the entire world on healthcare, and we have the worst maternal health outcomes in the industrialized world. South Sudan has better outcomes than we do. Racial disparities exist. We see this across the board, again, citing the maternal mortality review committees, which were funded through legislation from 2018 2018, and we're seeing that there are issues within our Black and Indigenous populations, three times more likely to die from pregnancy-related complications. And when we're talking about maternal mental health, these are temporary, they're treatable, and drum roll please, they're actually preventable. We need to be talking about this in every room. I'll always go back to Hamilton, in the room where it happens. And I don't care if that's your dinner on Sunday with your family, if you're out with your colleagues, wherever the discussion needs to be had, to your children who may be college age, to your children who are maybe facing depression issues related with perhaps a very difficult past year. It needs to be discussed and normalized. Depressive issues, almost everyone in our country, I think it's 70-something% of people face mental health complications. It is normal. We need to normalize these issues, and it's the same with maternal mental health challenges. Again, just to nail home, as we talk about policy, these are very important facts and figures to understand that suicide and overdose combined are the leading cause of postpartum death in the first year of postpartum. And 100% of these deaths are preventable. And again, I think the majority of us are here in this Zoom room today by way of lived experience or know somebody who's faced these issues. And so I know we're all incredibly passionate to make sure that nobody has to face what we have faced, and it's needless. From the federal landscape, there are a ton of legislative priorities. You couldn't pay people to understand what this issue was in 2015, 2016, and now it's the hot button. Okay, it's hot. Why? Because when we mobilize and we come together, it's one voice makes a difference. It's going to be your voice. What I always said, I did this from the red kitchen table of my house with one baby on my boob and the other on my leg. And you can do this. Okay, you can do this. It just takes your voice. It takes one voice, and it has gone to the point where we are focusing on access and treatment and support for maternal mental health conditions, focusing on growing a workforce. It's a shortage workforce overall in mental health. It's even infinitely more shortage workforce when it comes to maternal mental health. And when we're looking for providers that look like us, we see that there is an incredible lack of access for Indigenous folks that are Indigenous specializing in maternal mental health complications, or at least being culturally aware and culturally appropriate on that line, to linguistically available opportunities in Black and Brown providers. And this is something that we need to be committed to as a nation, to make sure that that is not prohibitive in seeking services. There is this phenomenal package called the Black Momnibus that has been introduced into Congress, both in the Senate and in the House. It is currently in this, quote, budget reconciliation. I'm assuming you hear about it all the time because your senator is Kristen Sinema, and she seems to be on the hook for a lot of this going on these days. And we have 12 bills that are addressing maternal health and maternal mortality crisis. Medicaid extension. Here I live in cozy little Massachusetts, the 6th smallest state in the country, and we have this thing called universal health care. Nobody goes without health care in this state, and there were no challenges around postpartum care, except when it came to postpartum screening. There was a huge gap in who was getting screened for postpartum health care, and that was within our Medicaid population as well. And it's something we've got at the State House. Every single person deserves to have full coverage when you're kicking people off of their health care 60 days after they give birth. As a mother of 2 and a mother of my community, I don't know one 60-day-old baby that's able to take care of themselves. If something happens to the parent, there's going to be dire consequences. And we see, especially around maternal mental health discussion, it's 4 to 6 months that it peaks at the highest. And we're looking at 6 to 9 months around suicidal ideations. And we're not even discussing the substance use part of that during this pandemic. 45% increase in substance use in this country. We've been fighting very hard on funding. We supported the current administration, at least I did, that is in the White House, our phenomenal mom warrior, Vice President Kamala Harris, committed to making sure that maternal health would be a discussion point for her. And they have committed to that, as has our Congress. And to be very frank, it's been very bipartisan. And we continue to work with our congressional leaders in the House and the Senate to get more money for telepsychiatry access programs. We are already in 7 different states right now, and we were able to get more money for 5 additional states. And you will be seeing, great news just came out, you'll be seeing that there will be a 24/7 maternal mental health hotline in partnership with this phenomenal organization that I think all of us know and love, Postpartum Support International. I've probably absolutely run out of all of my time, but I want to just quickly say budget reconciliation, we're seeing investment in social determinants of maternal health, which is absolutely spot on, like lack of housing, access, nutrition, environmental conditions. We're looking to put $100 million into maternal mental health equity grant programs, get those boots on the ground, community-based organizations, $75 million in funding specifically for community-based organizations, focusing on maternal health equity, $275 million to grow and diversify the perinatal workforce, doulas, nurse, midwives, physicians, maternal, mental, and behavioral health professionals, and make sure that there is access to Medicaid and CHIP coverage for a full year postpartum in every single state, that it's not going to be an option. Here are some of our calls to action on legislation. These slides could be sent out to this group after the fact, but want to let you know we are in a sweet spot where your voice matters. Get engaged, use the advocacy toolkit. You can pop some questions and I will respond and can pass the baton over to Breann so she can pull up the rear. And I apologize for going over my time. Thank you.
Thanks so much, Jamie. And you're not over time at all. You're doing great. If you have anything else you wanted to say, you have a little bit more time.
Oh, wow. I'm trying not to talk too fast. I know Bostonians are always being told we talk too fast. How do I go back? Yes. Okay. So again, here's what I want to say. This is big. This is federal. It is, but it isn't. It's the same issues. It doesn't matter if it's Tucson, if it's Phoenix. I don't really know any other major metropolitan areas to cite in Arizona, so I'm going to stop there. You know, maybe it's Sedona. Where did I live? Flagstaff. I love that place. But you know, here's the thing: do you have a city council? Do you have a town select board? Do you have a public health nurse? We actually solicited the public health nurses here in the tiny hamlets where I live. And now what they've done is they got a grant and they go make a home visit. If the family doesn't qualify for home visiting under the MCV program, they go to every new family in the area with information on services in the area, family groups, play groups, any postpartum mental health resources. And these are the things that make a difference. They went to our hospital system and applied for a grant, and they got the grant, and it was $50,000. And they were able to take that $50,000 and within like 8 communities, build out an entire program that goes out to the community and checks in with the mom. And because of the networks that we tend to see grow organically within our spaces, this mom's having an issue with breastfeeding, which can be an issue that can really affect postpartum depression, what we call postpartum depression. Guess what? They know who the IBCLC is or who the lactation consultant is. Then they pick up the phone and they call them. You don't feel like yourself? That's fine. That's okay. You're not feeling well. You're having a lot of anxiety. Guess what? We have a whole list of support groups and clinicians that we can share with you and connect the dots on that local level. I am excited to hear Breann talk about the model of community healthcare around pregnancy, because I think that we as mothers, we as parents, we as birthing people do find our communities and start to share information and find that support. And I think that these are the things that we can talk about at the community level. How can you uplift what's happening in the community? Is there early child education programs being run at the library? If there is, great. Let's take the local maternal mental health services and bring that to the conversation. How do we incorporate and engage in getting our elected officials in our communities, in our tribes, in our specific cultural groups to start talking about this? Because again, none of us want to be in a position that at least I know I found myself in, was Googling what is wrong with me at 3 o'clock in the morning. We want folks to be able to have access to those resources. And so I continue to say, working with organizations like us at the federal level, we cited 2020 Mom, more at the state level. Arizona has phenomenal legislation right now that, in Jenny, correct me if I'm wrong, that there is an actual maternal mental health commission that was formed based, I take some pride in saying here in Massachusetts, we've had one for 10 years. But that's great. Every state should. And I'll go back to even Jenny saying, Jenny, you spoke to a now legislator who happens to be a colleague in your academic space. Is that correct?
Right. When we spoke, we found out Representative Shaw and Representative Germain, the two of them had sponsored the bill to make the Maternal Mental Health Advisory Committee for Arizona. And it just so happens that I knew Representative Shaw before he became a legislator. And he's an ER doctor. So so we're really delighted that he has supported a lot of other maternal health stuff that's going on in the legislature. So it was really cool that we got to make that connection. And I'm so glad that you brought that up to us, because it was, it's huge. And we can't wait to be moving forward with that.
So what Jenny just said is really how a lot of this is done. I picked up my phone when my youngest was 1. And it was after Miriam Carey had gotten shot by the Capitol Police. It was 2013. She was shot and killed by the Capitol Police. She was in a psychotic episode, and her 1-year-old was in the back seat. And I said, that's it. That's it. We're not doing this anymore. If one more woman dies because of our ignorance, we are failing as a society. And I picked up the phone and I made a call to my state senator, who was going to be having office hours down at my library. And I went down and I met with her at the library of my town, population 6,000, and half are cows. And I say that jokingly because it's a very small community where I live. And I said to her, do you know what postpartum depression is? And she said, I think I do. I think I do, because I think this happened to me. What is going on here? And I told her what was happening. And I told her why I was seeing her. And I told her that the hospital systems were not doing the right things here, and women like me were getting left by the wayside. She is now the co-chair of the Postpartum Commission for the Commonwealth of Massachusetts. And we have gotten exponential amounts of support to extend the telepsychiatry access program. We have a racial disparities task force here in the Commonwealth of Massachusetts. And we have services that extend out, covering any moms that are dealing with substance use issues and keeping those families together, not separating them, getting families healthy. And it just took one conversation. So I encourage, wherever you can have those conversations, you can be in the room where it happens and make sure that that impact is there. Again, one voice can make a difference. And I think I've concluded my time. And I thank you all very much and look forward to seeing where we go next.
Thank you so much, Jamie, for your experience and your passion, and for giving us an idea of what's going on at the national level. I think I'm excited that things are changing. I'm not excited that we're in the state that we're in, right? In terms of how things are working. And the fact that we need to move things forward, but I'm really excited that there is change happening. And so thank you for sharing that all with us. And so we have an idea of what's happening. At the national level, and what we have to shoot for as well, I think, as far as on the state level goes. So thank you. All right. So now we're going to move to Breann Westmore, Director of Advocacy and Government Affairs with the Centering Healthcare Institute. In her role as director, Breann works to create and support evidence-based health policy, develop a pathway for access to care and payment reform, as well as mobilize advocates to expand the utilization of the centering model. She comes to the Centering Healthcare Institute with over 15 years of maternal child health leadership in state government and nonprofit sectors, and is also a certified health education specialist. Prior to joining Centering Healthcare Institute, Breann served as the Maternal Infant Health and Government Affairs Director for the March of Dimes for 8 years. A dynamic speaker and advocate in the correlation of good public policy and health outcomes, Breann's work has included expanding access to care, payment reform, and enhanced data surveillance and monitoring. Past honors include Arizona Best of Capital Top Advocate, Arizona Women Achiever of the Year, and AMCHP Young Professional of the Year. Welcome, Breann.
Hi, thanks for having me. Let me see if I can share my screen. And all right, can you see that okay? All right. So thank you for the super kind introduction. And I'm really excited to be here because this really is part of my passion. I have 2 young kids, and if you're in Arizona, you will relate to me in the fact that it's fall break. So apologies if you do hear them in the background because they are here. I think that my awareness and awakening and passion for maternal mental health came with my first, who out of nowhere was in the NICU at 41 weeks, perfectly healthy pregnancy. And it completely sent me in a tailspin. You would think for someone that worked at an organization who helped moms in the NICU, I would have been prepared and knew exactly what to do and how to handle it. And that was not the case at all. And, you know, preaching to the choir that nobody checked on me. It was only about my baby who was in there, and nobody was asking that breastfeeding's not working. How can we help you? We see you're not sleeping. So all that to say, thank you guys for showing up and doing what you do to help moms and babies in Arizona. I'm going to quickly go through a little bit of the history of how Arizona's gotten to a place that we are having this conversation at the Capitol. So in 2018, a concurrent resolution, which is a legislative measure, was adopted by the House and Senate. And what that means is it lacks force of law. It's non-binding. It doesn't require the governor's approval to happen. It's something that is generally used when making declarations, stating policies, making decisions, and kind of bringing awareness to an issue. And so in 2018, we worked on a continuing resolution, HCR 2038, to make May 2nd, Arizona Maternal Mental Health Day. So this was really exciting. We had a press conference down at the Capitol. We had great speakers, passionate advocates, and at the time this was run by Senator Carter, and she was a major champion of the effort for us. Another thing that is something similar that could be done is a proclamation, and those are done out of the governor's office. Again, it's just an excellent way to provide valuable education and information to Arizonans with the help of coming out of the governor's office. And if someone would be interested in doing that, it is done at the governor's discretion, but they need no less than 6 weeks notice and no more than 3 months notice. So things to kind of think about if you want to do something again for May 2nd, or if there is a conference or anything that you would like to get together to make a proclamation of that day. That's the process of how that works. And so that was 2018, 2019, we kept building on that. And this was probably one of the biggest highlights that I've ever had the opportunity to work on is Arizona up until this point did not look at maternal deaths. And it was for a lack of, sorry, I know you guys hear that.
No worries at all.
That we had kind of gone through economic up and downturn, and the Department of Health, who housed the program, had vacancies in positions. So unfortunately, what we learned was that these deaths were sitting on a desk and not being reviewed. We weren't honoring those families and learning from what happened through clinician tales to improve the system. So we ran Senate Bill 1040. requiring the department to look at maternal deaths and submit a report to the governor's office, indicating how they were going to build on that process, what that means. And then we did create a mandatory reporting element to update Arizona as far as what the deaths have looked like in the past 5 years. And that information is now available. What we do know is that nearly 90% of the cases of both pregnancy associated and related deaths were preventable. So that's exactly what we want to find out and capitalize on how we keep improving that. In 2020, 2021, I lumped them together because, well, COVID. And so they really just kind of did become one big year. And in 2020, a group of stakeholders led efforts around a women's health package. And to my knowledge, this was the first time that we had really done this omnibus bill in Arizona to look at different elements of healthcare and package it into one umbrella. We looked at the issue of postpartum visits and how can we create an incentive for providers to bring women back for that visit. What we know is about 20% of women on access return for that postpartum visit. And so anybody can remember being in those shoes that has had a baby and you are just spinning in all different directions and trying to get back to that doctor's office is not the first thing on your mind, even if you are suffering any kind of mental health incidents. Nobody's reaching out and reminding. So we're looking to have that conversation with providers of if they hit a 60% retention rate, would they qualify for X amount of incentive in payment? So unfortunately in 2020, that did not pass because again, COVID really just had the shutdown of the government. We also ran Senate Bill 1392, which was looking at extending the postpartum period, which, you know, I like to say we were ahead of the curve because now nationally this is a big conversation. So this ultimately wasn't passed as well, but it began a great conversation of talking about women and birthing people in the gap coverage, where you make too much to be on access and you make too little to buy marketplace plans. So that good work is continuing. I'll talk a little bit about that. But what did pass in 2021 was Senate Bill, when we first ran it, it was 1290, but it did change numbers, and that did pass in 2020. It was a Senator Mesnard bill, and what that did is create a council to look at women's maternal mental health specific to our Medicaid population. So where this differs a little from what I think Jamie was talking about, and again, another kind of nugget for an idea, is creating a standing council to look at maternal mental health in Arizona. This does have a end date of it, so it would be at the recommendation of this 21-member council to indicate if they thought it was best practice to have a standing council like this. I'm not privy to any of the conversations of the 21-member council of what they're looking at, but I would just put that as a nugget, as an idea for efforts going forward, is to have a standing council that could meet and discuss type of issues. For 2021, then the advisory council that we first ran in 2020 turned into 2021. And again, I indicated Senator Mesner were the one that ran that. So we are anxiously awaiting the report that will be released in December of 2022 to look at what do we think the system can improve upon. Is that screening rates? Is that a referral system? Is that payment? Hopefully all these things will be addressed when they release the report. And again, kind of just preaching to the choir that we do have some states doing it really, really well. At least 13 state Medicaid programs cover maternal depression screenings. Currently, Arizona does not. And there are 37 states that allow, require, or recommend that Medicaid cover maternal depression screenings at well child visits, and currently Arizona does not do that either. So a lot of room to improve in the things that we do here, and actually have other state examples to point to. I want to highlight that Texas just created a state strategic plan for postpartum depression, and I think it is bigger than just postpartum depression in their strategic plan. So it really does encompass a lot of maternal mental health. So I would look at that as a great place to start to see if Arizona has the capacity to build out a strategic plan around this. I know there's great movement at the Department of Health Services with efforts being led from Title V grants around this. And that may be something that they are working on, but worth, again, kind of just noting and saying, hey, can Arizona come up with a common language, all moving in the same direction in strategic plan? With that, I think we have not addressed the mandatory screening, the referral network issue, public awareness campaign. Other states have done that. Prescription coverage is also an issue for women who are on Medicaid that may not be able to fill a prescription based off of it's new to market or trial. And then the use of telemedicine and network adequacy as being able to be worked on for making sure that members of all paying plans can see mental health providers, maternal mental health providers. I only throw this in here just to say that doula legislation was passed last year as well. We know the benefits that doulas have for birthing people and within that their mental health. So this is something I think that will be interesting to track as it kind of moves down the pike. Currently, they're in the stage of creating the registry repository of doulas with the long-term hope, I believe, of having doulas as a covered benefit under Medicaid. So what are some of the emerging trends that we think we're seeing nationally and hopefully in Arizona? Again, the extension to postpartum Medicaid that we talked about earlier. Currently, you have coverage if you're on Medicaid and in that SOBRA population, what we call SOBRA here, that you have coverage for 60 days. What we're looking at is really getting that coverage to 12 months, because we know that a lot of the pregnancy-related and associated deaths happen between 43 and 365 days postpartum. So right there, we already know that they are not being followed by a provider. They're not having anyone check in with them. You basically are kind of cut loose. And if that pediatrician is not going above and beyond their scope, there really is nobody there looking and helping mom. The United States is the only developed country where our maternal mortality rate is continuing to steadily rise. And most of the data out there points to, if you have coverage, by extending postpartum coverage, that is a reduction strategy to maternal death. So currently you see states doing both 1115 waivers to add this coverage. There's also a state plan amendment that will be able to take place in April for states to adopt this. So what that means for Arizona is we have to find the money to be able to pay for those in that gap coverage. So the women, the birthing people who are in the SOBRA population that fall above the 161% poverty level are who the state needs to find funding for if they are going to implement this. I know that there is talk of this legislation being run next year. So if anybody is just overly passionate and wants to get involved, I can definitely make connections for you to get into some of the coalitions that are beginning this conversation. Things that we can do as a collective is identify family stories that of families who were kicked off of coverage and needed it, to be able to make those real life examples. And we're working on getting what the actual cost of this would be. So we know that's going to be a question that comes up. Another emerging trend, which I get to have the pleasure now of really intimately talking about, is group prenatal care and group parenting. So the research is out there that when we group people with lived experiences together, they do better. And so a lot of states are including in their Medicaid payment plans group prenatal care. And so this is where women and birthing people receive their care in a group setting. There's usually about 8 to 10 women, and you're pulled out individually to see the clinician and do those type of exams. It's about an hour and a half long, and during that other interim time, you are asking questions, gaining knowledge inside of a group led by a qualified facilitator. So some states, as I indicated, have added this as a way of payment. So any provider who is implementing this model in, say, Ohio, gets paid at an enhanced reimbursement. So they have incentive to financially want to do this model, as well as they all see the better birth outcome data from implementing this model. So it's really a win-win, and we're seeing great strides being made from it. 2 states, New York and Georgia, use grant dollars to fund enhanced reimbursement. So that's another opportunity that Arizona could look into with the Title V grants, is granting those to physician offices to implement. 13 states reimburse providers in other ways. And 16 states, unfortunately, do not explicitly promote group prenatal care, which is currently Arizona. Another way that we're looking to work with states is just to get them to turn on that ICD-10 code of, is a provider implementing group care? Because right now we just don't know what we don't know. And if you are just so excited about all of this, kind of what can you do? Reach out to your members. And you can go on to Arizona's website. And if you don't know who your member is, you can just hit your address and it will tell you who your electeds are. You can find that out for both Arizona and federally. Call them, write them a letter, schedule a meeting, use social media. I often find using social media is a really quick way to get their attention, and tag them in posts that you see on issues that you're supportive of. Advice into doing that: do your homework ahead of time. Make sure that you are sharing and promoting the correct information. Know that person's voting history, where they stand, their background, their committee assignments. And don't forget to make an ask. Ask them what you want them to do. Is that voting yes on something? Is that speaking up on the floor? Is that sponsoring a bill? Make sure that you're making a direct ask, and then keep in touch. Once you have a meeting with them, oftentimes that member is excited to hear about a topic that you, their constituent, are passionate about. So keep them informed. And then the resource list could go on and on, but these are just some of the national organizations out there, national and local, who are working on these issues. They all have listservs. Depending on where your interest lies, you can join their listservs. They send out, monthly, sometimes real-time updates around advocacy. And a great way just to kind of get plugged into not only a national movement, but then be connected with people that are state allies as well. So I will stop sharing my screen, and if I can, and then hopefully be able to answer some questions.
Wow, thanks so much, Breann, for sharing that wealth of knowledge. That was amazing. Yeah. So we appreciate both of you sharing your perspectives and your experience with these things and giving us so much information about where maternal mental health policy is headed. It's actually amazing, and it makes me feel like we can actually make a difference. We do have time for questions now. Elizabeth, do you have any questions queued up for our speakers?
I do, yes, thank you. I'm trying to figure out, I don't know. Okay, here we go. Too many screens up, things going on. So I just want to say thank you again to Jamie and to Breann for being here. I can't tell you just the wealth of knowledge you shared in just this short amount of time. I'm going to need to go back and rewatch and take even better notes. So thank you so much. I think this is going to be tremendous for helping propel us in Arizona to a better canvas of maternal mental health care. So with that, I know that, Breann, when you were speaking earlier about the transportation of getting women to their 6-week postpartum visit, or getting people to the 6-week postpartum visit, I know Eileen in the chat had dropped in, was there transportation, was the funding for the transportation available to get women to that 6-week visit?
So the incentive money wasn't necessarily thought through to direct it to the patient. It was really at the provider's office to make them internally look at, okay, how many of our patients are coming back? Because right now, they're not necessarily looking at that data. It isn't a reportable metrics publicly, so it's not something that they've had to answer to per se. I do know that if that woman is on Access, they have transportation available to them through Access. I know for a while they had a partnership with, I think, Uber in certain areas. There's also other ways that Access can reimburse that person for transportation. But again, when you fall outside of that 60 days, then that is not available to you anymore. So hence the reason why we really want to look at this year-long period. But I think that there's also more creative ways to reach that person than necessarily having to have them come in the office. Yes, the clinical exam I think is very important, but other states and countries look at home visiting methods and having that nurse go into the home to see the woman. We also know the benefit of seeing the patient before 6 weeks. 6 weeks is a really long time when you have an infant and every day and night run together. So there is evidence out there from ACOG that seeing that new mom around 2 to 3 weeks postpartum is an ideal time to address any maternal mental health issues that may be starting to arise.
Thank you so much. Yeah, and Jenny, we want people just to unmute themselves too, right? If they have questions.
Absolutely.
So,
Yep.
yeah. So if you guys want to, if anyone else is out there, I will put a pause at the end of this. But if you have a question, just unmute yourself and add yourself to the conversation here. If you're not comfortable doing that, feel free to use the chat option as well and drop some questions in the chat, and I'm happy to read those off for you. So I'll just leave a space here in case somebody would like to unmute and ask a question. Otherwise, I'll go on to our pre-canned questions.
Hi, Breann. This is Allison Lucas. I'm actually the Title V Block Grant Coordinator for Arizona with the Arizona Department of Health Services. And I was just curious if you could, I didn't catch, could you repeat the 2 states that are using their Title V funding to reimburse providers who conduct group prenatal care?
Sure. So New York and Georgia are the ones that most people point to, but I did just have a call with Indiana. So I know that they are looking at that as well. It very much is an emerging topic. We have seen grant dollars go out in Ohio as well. I'm not sure if they were through Title V or if they were through another state funded opportunity, but I would encourage you to contact Indiana, New York, Georgia, and Ohio to kind of look at different methods that they're doing.
Perfect. Thank you very much.
I have a question. This is Eileen in Tucson. I'm not quite sure who this is for, but PSI International, somebody talked about Arizona being a fellow, and then I kind of lost the rest of it. Can somebody remind me what that means and how we are involved and how we can support PSI more?
Eileen, I don't, so PSI, Jamie was talking about how PSI now has the Maternal Mental Health Hotline, right? That's been funded. So that was probably part of it. And then the fellows program, that's 2020 Mom, and Fourth Trimester Arizona is the nonprofit backbone organization for that, the Arizona effort.
Got it. Okay, thanks.
Yeah, thanks for your question.
Yeah, and I also saw that Sarah Ruman is on the call. So Sarah, I know you represent PSI and have been doing that for a while. If you want to, would you like to add anything to that?
Sure. Can you hear me? Okay. Yes, there's a Arizona chapter of Postpartum Support International. We've been established for the last, I would say, 4 years as a chapter. We're associated with the national chapter of PSI. In the past, we did operate a local helpline, warm line with volunteers. But because of the enhancement of the national line in their abilities to do text responding and real-time responding, we transferred over to the national line. So right now, any calls that come in on the national line actually then become referred back to Arizona, because we have coordinators in different locations throughout the state that have volunteered to be PSI coordinators, and they will take calls from individuals that are having issues and make those local referrals to services, treatment services, and other providers. In some cases, they might be a provider. And so in that case, they arrange perhaps for services to be provided. Michelle Lacey is one of our coordinators, and Deanne Davies is one of our coordinators, and there's just a few others that are now coordinators with PSI, and they're listed on our website.
Thank you so much, Sarah. Yep, and if you want to check out the website, the link is posted in the chat, so you can go ahead and peruse and connect to all the wonderful resources there for PSI. I have one more question that came from our prior or pre-session questions, and it is asking around reimbursement. So I'm not sure if this will be for Breann or if it'll be for Jamie, but the question reads, one of the issues that continues to plague Arizona is poor pay for mental health providers and issues with reimbursement in integrated settings. How can we work with the state to address this underlying cause of access to care, and have other states have been successful at getting reimbursement?
So that's a loaded question. I think that what first needs to be done is there needs to be a study across the states of how much are providers getting paid in each state. We understand that there's going to be geographical differences in cost of living, but what can we pull out as a commonality around how providers are getting paid and what that amount is? We know that different states pay different amounts for screening. So some states pay an additional $2 per patient per time they're screened. Some, I think, pay up to 15. So again, making that research and finding out what other states are paying their providers would be key. Also know that Arizona has a bundled birth package, so it is a negotiated rate. That's not to say you can't be creative and do carve outs and ultimately look at renegotiating the birth package if that's the way that it had to be done. But I think that as far as payment goes, a lot of that is going to start with the payer and making sure that the payer understands the payment needed for a specialty in maternal mental health. And that kind of starts with recognizing maternal mental health as its own specialty. So to answer that, I think it's a multi-pronged approach of how you get there, but all of those things need to move in conjunction to make that happen.
I just want to piggyback off of what Breann's saying, and I thank you for your expertise in the detail, because I certainly don't have that, but I do want to say that this element of the reimbursement and not covering services at the cost that they should be reimbursed for, and even, different offices voluntarily not even following through, because why is it worth it for them, right? I hate to say that so much of the conversation sometimes comes down to the dollars and cents, which it shouldn't, but I do want to say that this is a universal part of the universal discussion. And with the dollars and cents piece, I had seen that Elizabeth shared the Mathematica review, which I'm hopeful that Arizona is able to obtain the same sort of overview on what the actual expenditures out of pocket are for undiagnosed perinatal mental health challenges. They put here at the high level that Mathematica review, if memory serves me correct, it was, it's 14B, 14 with a B, not an M, but a B billion dollars, right? And I hate to say that again, because it makes me very upset to think that we have to have a cost expenditure to everything in this country, because we only seem to value money over people. But when we're talking about these things, it's very important to say, hey, if you're concerned from the financial angle, take a look at what money's going out of the pocket here. And again, from the state level, I don't know how I don't think you can mandate. I don't know how that happens with reconciling payouts for screening, but it is a conversation being had universally from what I see. So I lean on folks like Breann to tell me what I have to do to make that happen.
I think I'm ultimately hopeful that the 21-member council that has been pulled together will recognize one of the best practices is screening, and will make the recommendation that Arizona make that an enhanced payment. So everybody's on the edge of their seat to see what the council is going to recommend. But if I was on the council, that would probably be one of the things that would be first up, is looking at the evidence-based screenings and making sure that providers are funded appropriately to do so.
Thanks so much, ladies. That was, yeah, I think you've given us a ton to think about, a ton. As we start to move forward. And it's also great to know that there are other states that have gotten a little further than us and have, you know, some models for us to go by. I think that's actually really helpful as we start to think about what we want to do as a state to support our mothers. Because yeah, substance use disorder and maternal mental health, you know, being on the Maternal Mortality Review Committee, it's such a huge percentage of the deaths, and it's totally preventable, right? Like that's definitely something we want to make sure that we are moving towards. So I want to thank you both for talking with us today about policy and where we can move forward in maternal mental health. As we wrap up, I'd like to share with everyone the opportunity to get involved with the work that Fourth Trimester Arizona is doing with the 2020 Mom Policy Fellows to get legislation passed to improve maternal mental health in the state of Arizona. And it sounds like, Breann, we need to talk to you a lot, including, you know, one of our thoughts is to get a resolution passed to make May, the whole month of May, an annual maternal mental health month for our state. So we're going to pop the link to a Google form into the chat, as well as if you use QR codes. I figured out how to make one. I'm very proud of myself. You can go ahead and click on that one if you'd like to get involved in some way in what we're doing. Thank you all. And please know that our next lunchtime conversation will be happening on November 5th. So the first Friday lunchtime, and it will be focused on the impact of COVID-19 on infant and child development. So we're really excited about that. I know that was one of the very popular topics at our summit last week as well. So I'm looking forward to that one. And Elizabeth's popping a few more things in the chat. Please remember that, you know, your participation in this fourth trimester ecosystem is what makes it what it is. And we so appreciate all of you for being here and having these conversations, as tough as they are, and making connections and beginning to envision what our state could look like if we wanted to change how it is. It makes a huge difference to just begin to envision that. So thank you all for being here today. In the coming week, keep an eye out for an email with a link to the recording to share with others if you'd like. And I think this particular recording, very, very valuable for us to share with others as we go forward in our efforts. So thank you so much again, Jamie and Breann, for being with us today.
Thank you all very much. And I know I'll be looking to get copies of the slides, and feel free to share mine. Thank you so much.
Thank you. Yeah, thank you so much. Super interesting conversation. All right. Yeah, and thanks for your great questions, everyone. They were really helpful and insightful. All right. Well, we hope to see you again soon. I hope that if you're going on fall break, that you guys will also survive the week or two that you're on. My kids are on fall break too, so we're just starting that. But yeah, I hope everyone gets some time to enjoy the weather at least. All right, thank you so much. Yep, we'll go ahead and end. Let's see. All right. And here comes my child right on cue. Awesome. All right. If you're still here, you're welcome to chat with us, but we're just going to pop off in just a couple minutes. Hi, Sabrina. How are you?